Welcome back here to Adelante Chicago. Trying to find the right doctor or the right medical service can be very frustrating and very time-consuming at times. Connecting patients with the medical care they need is the goal of an organization known as Wellness West. And here to talk a little bit more about the services that they provide are Misty Drake. She's the executive director of Wellness West. And right next to her, Rigoberto Rigo Pantoja. He's a community health network. Thank you so much for coming in, both of you.
Thank you for having us.
All right, let's get down to it and explain what Wellness West is, because it's sort of you've brought together a number of organizations to offer help for neighborhoods.
Yeah. So, the pandemic was an interesting time for a lot of different healthcare entities. And I think what we all recognized working in healthcare, that the work that we were doing in our own institutions was good. But what we also recognized was that there were still these huge health disparities that many of our patients throughout the city of Chicago, throughout the state of Illinois, were experiencing. And so while we do work good individually, we see health outcomes are improving. When we see the population of folks that live on the West Side, that there are these huge health disparities. And that was just really the premise for a lot of the major health institutions, community health centers, community-based organizations, community mental health centers, coming together to say, we want to do something different. We really want to work together collaboratively to change the way that people get care and to change their outcomes to further reduce health disparities.
All right, before I move to you, Rigo, I do want to continue this line of questioning and conversation. When we talk about health disparities, what are you noticing from neighborhood to neighborhood? What are you noticing on the West Side that maybe the South Side may not be dealing with?
Yeah, well, it's interesting that you say that, because I think what we see across a lot of different communities, not only on the West and South Side, but quite frankly, even communities in rural Illinois, it really has more to do with socioeconomic status than anything, right? Where there's this disinvestment in these communities, where oftentimes social drivers of health impacts your health, right? So if you don't have adequate housing, if you don't have adequate food, places to shop for food, if you're fearful in your neighborhood, those things impact your health. And so that's one of the premises that we're trying to work with Wellness West and the 42 providers that are a part of our network. We're ultimately looking at ways in which we can reduce social drivers of health so that folks can be able to achieve healthy outcomes.
Okay, I like the sound of that. Rigo, I want to move on to you because you're actually in the neighborhoods. You're talking to folks day in, day out. And I asked you at the beginning of this, before we actually went on air, what is sort of the number one question, the number one issue that folks are having, and how are you able to help them?
So I would say the main thing is people need help with rent at the moment. And we have different programs that we can help them apply for, but that's where other organizations within Wellness West come in, where we can refer to them, the patients to them, and then they reach out to the patients and kind of help them a little bit more with that, with the housing situation.
Okay, so on any given day, if you have somebody who comes to you and says, listen, I am in need of assistance with rent, what is your role? How do you then help them? Walk me through how that would work.
I would say our main focus is their health care. So we just make sure that they have everything they need when it comes to their health. And then the secondary focus would be with like external resources like housing. We sometimes help them apply to like other programs. Like sometimes the application might be in English and they only speak Spanish, so we help them fill them out and things like that.
Okay. Always very helpful in communities where language is a barrier. So thank you for the work that you do. I want to come back to you and talk about some of the things that are coming up that people may be a little bit confused about. And I mentioned to you this whole issue with SNAP benefits and that there's new deadlines that people need to be aware of.
Yeah. So, with the emergency period, it afforded the opportunity to really extend benefits, for Medicaid individuals.
During the pandemic.
During the pandemic, right. And so, now that the emergency period is over, folks are losing benefits. And again, what we're seeing with the work that Riggy is doing and some of the other community health workers is that Food insecurity, for example, housing are some of the main drivers of health. And so with them losing this benefit, this is further going to perpetuate kind of the way that they get care and how it impacts their
Yeah.
care. So the work that community health workers like Riggy are doing is very important. It's important in terms of removing those barriers, connecting them to social interventions that really help food insecurity, that really helps with housing. Riggy is an extension to the care team, to the new way we should be thinking about how we deliver care, right? Where you have the medical provider and you have the healthcare team, but then you also have a community health worker that's from the community, that looks like folks in the community, that's really helping patients to navigate through our system, can be there to really remove those barriers to care so that they can really concentrate on their health care as opposed to the social drivers that impact it.
The second piece of this is this whole issue of mental health.
Yeah.
Help that's needed in so many communities. Are you able to weigh in on that and help them along that process?
Absolutely. You know, part of it is also looking at ways in which you can enhance the workforce, right? Being able to extend specialty care. So we're also looking at ways in which patients have access to specialty care, particularly around adult psychiatry and ped psychiatry, really looking at the ways in which pediatric patients experience trauma and how social workers and CHWs can really help them as they kind of experience those trauma events.
Okay. Do you feel like things are getting better for so many folks in our communities in Chicago?
So that's a fantastic question. I mean, I think the beauty of it is that, you know, every institution, we have 42 providers that are within our network. They can clearly be doing things on their own, can continue down their own path. And again, what they all recognize is that we have to come together. We have to do something differently as a collaborative if we really want to see real results in our community. And I think that's the beauty of it.
All right, let's hope that as we've come off of this pandemic, that things start to get better. I know it's been a tough few years for everybody and every organization, so hopefully things are improving. We do have a website that we want to share with you. There it is on your screen, wellnesswest.org, to get more information about the work that they do and how they can help you or how you can help them.